Hi, can I come in?
Yep.
Hi, Shauna. My name is Jamie. I'm a nursing student with Cape Breton University. Today we're going to do a head-to-toe exam if that's okay with you.
Yeah, that's okay.
I'm just going to go wash my hands and get my stuff and I'll be right back.
Okay.
We're just going to start by inspecting your hands and just for temperature and everything. So the temperature feels good. They're warm. They're moist. We're going to check your capillary refill. That's good. And that's good. And I'm just going to check for early signs of clubbing. And they look good.
Okay.
Next, we're just going to do your head and your face. Is that okay?
Okay.
So I'm just going to palpate through your hair and your scalp and just feel around for any lesions or anything.
Okay.
Is it tender or anything anywheres?
No.
All right, that's good. And everything looks symmetrical, so that's good. Now I'm just going to feel for your temporal artery on both sides.
Okay.
That's good. Now I'm going to move to the joint here. And can you open your mouth, please? And close. All right, that's good. Now I'm just going to feel for some sinuses and let me know if there's any pain or pressure.
Okay. No pain.
And here?
No pain.
All right. Okay, now we're just going to do some tests with your eyes. We're going to start with your visual field. So, can I get you to cover one eye with this?
Sure.
And I'm going to cover an eye.
Mm-hmm.
And just let me know when you see my wiggling fingers, okay?
Okay. No. 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 No.
All right. Now we're just going to go to the other eye.
Okay. No. 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 No.
Perfect. I'll take this. Oh, actually, no, I won't. I'm going to get you to look at my nose.
Okay.
And I'll cover one eye and continue to look at my nose. And then I'm going to take it off just to see how your muscles react.
Okay.
So just look at my nose.
Okay.
Good. And now we're just going to do it with the other eye.
Sure.
Perfect. So I'm going to just check. I'm going to shine this light at your eyes, and it's just going to show like a reflection at the same part on your cornea, and we're just checking, once again, your muscles. Perfect. And can you follow my pen with your eyes, but don't move your head?
Okay.
Okay, good. Now I'm just going to inspect your brows, and they look symmetrical bilaterally. Can I get you to close your eyelids? All right, there's no swelling, they're not red, that's good. And you can open them again. And your eyelashes curve outward, so that's good. I'm going to pull down on the bottom of your eyelids and just look at your conjunctiva. So just look up, please. All right, they look good. Now I'm just going to shine this light across to look at your cornea. That's good. Yeah, this one. That's good. Now I'm just going to see how your pupils constrict to light. Good. Now this one. Good. Now can you just look at the picture behind me? And then when I tell you, just directly turn your eyes to my pen. So now my pen. Good. Okay, now we're just going to do the inspection of your ears.
Okay.
So they look to be at the same position bilaterally, which is good. There's no lesions, they're not red, that's nice. Both sides, that's good. So now I'm just going to move on your auricle and your tragus and just let me know if you feel any pain or pressure.
Okay. No pain.
All right.
No.
Okay, so now we're going to do a little hearing test.
Okay.
I'm going to get you to push on your tragus continuously while I whisper a few words in your opposite ear.
Okay.
And you just repeat the words.
Okay.
So if you want to start with that one.
Okay. Monday. Friday. Book bag.
Okay. Next, we're just going to go to your other ear.
Yep.
Wheelchair.
Wheelchair.
Staircase.
Staircase. Tuesday.
All right, perfect. Now I'm just going to inspect your nose.
Okay.
So it looks symmetrical for your face. It's midline. There's no lesions or redness. When I push on a nostril, I'm going to get you to breathe in. We're just going to check the patency.
Okay.
Good. Excellent. Okay, now we're just going to inspect your mouth.
Okay.
So can I just get you to open your mouth, please? All right, I'm just going to look up a little bit wider. So your palate looks good. Teeth, can I get you to lift your tongue? Good, your frenulum's good. All right, I'm just going to look at your gums. Good, and the top ones. Good, and can you just show me your teeth? Good. So I'm going to get you to stick your tongue out and say ah. I'm going to look for your uvula. That's good. And your tonsils are good. And now I'm going to test your gag reflex, all right?
Okay.
All right, that's normal.
Okay.
And can I just get you to stick your tongue out?
Okay.
Perfect. Now I'm just going to palpate your trachea, make sure it's midline.
Okay.
Good.
All right.
So can I get you to flex your head forward?
Mhm.
And now straight back up. And turn facing this way. And then the other way. And can I get you to shrug your shoulders? Good. Now can you turn your face against my hand? Good. And this side. Good. And just shrug your shoulders against my resistance. Perfect. Okay. Next I'm just going to inspect your neck.
Okay.
There's no bumps or lesions. Now I'm just going to feel for some lymph nodes, okay?
Okay.
Okay, that feels good. Yeah, I'm just going to check for your pulse, all right?
Okay.
Good. Good. Now I'm just going to palpate your thyroid gland.
Okay.
So I'm going to get you to lean your head forward a little bit.
Okay.
And turn to the right.
Okay.
Now I'm going to feel here, push this over a bit.
Mhm.
And can I get you to have a drink of your water?
Yep.
Good. Now we're just going to do it the opposite. So lean to the left a little bit. And continue to swallow. Perfect.
Okay.
Okay. So it looks good. Your shoulders look symmetrical with each other. Your muscles look good. I'm just going to feel your skin temperature is good.
Okay.
So I'm just going to check for the symmetry of your breathing. So I'm going to get you to breathe in. Breathe out. That's perfect. I'm going to feel around for any lumps or tenderness, so just let me know if it hurts.
No.
That's good. All right. So now I'm going to lay my palm on the back on your back and just say 99 each time.
Okay. 99. 99. 99. 99. 99. 99. 99. 99.
And two more.
99. 99.
Perfect. So now I'm just going to feel down your spine and let me know if it hurts. No. Perfect. Okay. So now I'm going to percuss, so I'm going to lightly tap over your lung fields, okay? I'm going to move this a little. Move it up a little. Perfect.
Okay.
So now I'm just going to listen to your lungs.
Okay.
Okay, I'm just going to check your kidneys now.
Okay.
And just let me know if you feel any pain.
Okay. No pain.
Okay, so now I'm just going to inspect your chest anteriorly.
Okay.
So I'm going to look for any abnormal pulsations, which I don't. I'm just going to feel for any lumps or tenderness.
Okay.
Just under here. Was it any tender?
No.
No? Okay, perfect. So, I'm just going to take a listen. Well, no, first we're going to do tactile fragmentus. So I'm just going to get you to say 99 again, okay?
Okay. 99. 99. 99. 99.
Move this a bit.
99. 99.
And just underneath.
99. 99.
Perfect. So now we're going to take a little listen. Okay, perfect. Okay, now I'm just going to take a listen to your heart, but first I'm going to start by just checking for any pulsations.
Okay.
And that looks good. So now I'm just going to take a listen.
Okay.
Okay, good.
Okay.
Okay, so now I'm just going to inspect your upper extremities.
Okay.
So your arms look good. Everything looks symmetrical bilaterally, so that's good. So now we're going to do a little range of motion and muscle strength.
Okay.
So I'm going to get you to flex your arm up.
Okay.
That's good. Now can you go behind?
Yep.
Perfect. Now we're going to go out.
Okay.
Great. And on the inside.
Okay.
Perfect. Now we're just going to do the other arm. So flex it up.
Okay.
Good. And behind if you can. Yep. And out. And in. Wonderful. So now I'm just going to get you to bend your arm up.
Okay.
good. And straight. That's good. This one. Wonderful. And can you go like this? Supination and down. Wonderful. So I'm going to get you to get your hands and perfect. So a little flexion and then back to normal. Spread your fingers.
Okay.
Make some fist. And hands like this. Can you put your thumbs?
Yeah.
That's good. Now, are you able to touch your thumb to each finger?
Yeah.
Wonderful.
Okay.
Okay, so now I'm just going to inspect your abdomen.
Okay.
So the contour is nice and flat. It's good. Your skin color is evenly distributed. There's no lesions. So it's good. So now I'm just going to take a listen to your bowels.
Okay.
Okay, so now we're just going to take a listen to your arteries, okay?
Okay.
Okay, so now I'm just going to percuss.
Okay.
So it's the light tapping again.
Okay.
And that's good. And then I'm just going to palpate, okay?
Okay.
All right.
Okay.
Okay, now I'm just going to check for your femoral pulses.
Okay.
And also you have some nodes there that I'm going to check for, okay?
Okay.
All right. Good. Good. And now I'm just going to check for some nodes.
Okay.
Good.
Okay.
Okay, so now I'm just going to inspect your lower extremities.
Okay.
So they're good. The hair distribution's even throughout. There's no presence of varicose veins.
Okay.
And now I'm just going to palpate some pulses. So this one's your popliteal pulse. I'm going to get you to lift your leg and bend it.
Okay.
That's good. Now I'm going to lift the other one and bend it a bit. Good. There's some pulses down here I'm going to feel for. Good. Yeah, and perfect. So I'm just going to check the temperature. Good, everything's warm throughout. I'm just going to separate your toes and inspect, okay?
Okay.
Okay, everything's good. So now I'm just going to check for your range of motion.
Okay.
So I'm going to get you to lift your leg up.
Okay.
Good. Back down. And then we're going to lift it out here.
Okay.
And also just a little bit over.
Okay.
Good. Now I'm going to get you to bend your knee. Good. And now I'm going to get you to bend your knee again, and we're going to rotate out
Okay.
and rotate in. And we're going to move to the other side.
Okay.
So I'm going to get you to lift your leg up. Good. And down. Bend your knee. Good. We're going to go out. We're going to go in. That's good. I'm going to get you to bend your knee again. And we're going to go out. And in. Perfect. Okay, so now we're going to move to the ankles.
Okay.
I'm going to get you to point your toes to the floor. And now point them up to your nose. That's good. And I'm going to get you to turn so the soles are facing in. Good. And then out if you can.
Mm-hmm.
Good. And I'm going to get you to spread your toes really far apart and squeeze them together. Perfect. Okay, perfect. So now I'm going to take this tongue dispenser. It's cracked in two. So when you feel, this is the sharp.
Okay.
And that's the dull.
Okay.
So I'm going to touch them just alternating or just in like a random.
Okay.
And you just let me know if it's sharp or if it's dull, okay?
Okay. Dull?
Yep.
Sharp.
Sharp.
Dull?
Yep.
Dull?
Yep.
Sharp?
Yep.
Sharp?
Yep.
Sharp? Dull? Sharp?
Yep.
Dull? Sharp?
Yep.
Sharp? Dull? And dull.
Yep. Perfect. So now I'm going to we're going to use the tuning fork.
Okay.
And it's going to vibrate. So when I lay it on, it's going to be on your hands and your feet.
Okay.
You're going to have your eyes closed. I'm going to have it vibrating.
Okay.
You tell me when you feel it start and also when you feel it stop.
Okay. Start. Stop.
Perfect.
Start. Stop.
Yep. You're moving on to your feet.
Start. Stop.
Yep.
Start. Stop.
Perfect. Okay, so next we're going to do a little test where I put an object in your hand. Your eyes are closed and you have to identify it.
Okay.
All right, so
A coin.
a coin, that's right. And
A marker.
yep. Okay, so now we're going to do a test. It's another sensation one. I'm
Okay.
going to get you to have your hands out like this. I'm going to move your finger up, so this is up.
Okay.
And this is down. You just have to tell me if it's up or down. So close your eyes.
Okay. Up. Up. Down. Up.
Okay, now the other hand.
Down. Down. Up. Up.
Yep, perfect.
Okay.
Now we're going to test your cerebellar function of your upper extremities by having you alternate your hands from pronation to supination and increase the speed as you alternate.
Okay.
Perfect.
Okay.
And I'm going to get you to lie down.
Okay.
So I'm going to have you lay your legs out flat.
Okay.
And you're going to take your heel and run it down the shin of your opposite leg.
Okay.
So you can start whenever. Perfect. And alternate to the other. Wonderful. Perfect. Can I get you to sit up so we can test the other reflexes?
Yeah.
All right. So we're going to start with your reflex up here. I'm going to get you to lay your hand on mine.
Okay.
And just relax.
Okay.
And you should see a little reflex.
Okay.
Perfect. And then we're going to I'm going to hold your arm, just let it dangle and relax.
Okay.
Actually going to hold like this, it's easier. And I'm just going to tap it, and once again it'll be a reflex. So just let this loose.
Okay.
Perfect. And we'll do your other side. I'm going to get you to hold, once again, just rest it on my arm. Okay, good. And now your other side. Perfect. And we're going to do this little one here. And once again, it's just a little reflex.
Okay.
And your other side. And then we're going to move to your knee, so your patellar reflex. So just relax your legs, let them dangle.
Okay.
Good. Really good. Okay, and finally, I'm just going to check your Achilles tendon, the reflex.
Okay.
So I'm going to get you to bend this and cross it there. Perfect. I'm going to just push it out a little and just let it have its reflex.
Okay.
Perfect. I'm going to go to the other leg, so just bend it and cross.
Okay.
Perfect. So now I'm just going to get you to walk a few steps across the room.
Okay.
Perfect. And on your way back, walk heel to toe.
Okay.
Wonderful. Now can I get you to take a few steps on your toes?
Okay.
That's good. And a few steps on your heels.
Okay.
Wonderful. Now I'm just going to get you to do your range of motion.
Okay.
I'm going to get you to bend over and touch your toes.
Okay.
Wonderful. And then lateral, so we're going to go this way and the other way.
Okay.
And rotate at the hips, so turn to one side and then the other.
Okay.
And also, can you hyperextend? Perfect. And last but not least, I'm just going to check your balance.
Okay.
So you can just stand here, don't buckle your knees, and close your eyes, and I'm here to catch you.
Okay.
Okay, perfect.
Okay.
And that was just to check your balance. You didn't sway abnormally, so that's all good.
Okay.
We're finished.
Okay.
So we've completed your head to toe examination.
Okay.
All of your findings were normal, and I was wondering, did you have any questions?
No questions.
All right, perfect.